Hello, everyone. We have an incredible guest. I know I say it every time, but really, Beth is amazing. I think, Beth, you and I met a long time ago. I would say about 5 to 7 years ago. It's where
Easily.
yeah, at a Women in Tech conference in Louisville, Kentucky, where you talked about your book. And I'd love for the audience to learn more about that. But right now, you're acting as a strategic advisor, as well as sit on several boards as a director. And we'd love to hear more about your thoughts on AI.
Sure,
Welcome.
sure. Thanks for the time and the opportunity. It's really good to see you again. And yeah, I'll start with I did write a book called Busy Bee, Queen Bee. Really just meant to help people step back and look at what they're doing and how they can really, delegate something, outsource it, or nix it entirely to really be able to free up time for themselves, so that they can spend more time with their family, they can spend more time doing what they love, and they can actually spend more time thinking. Because I think that's really important that people are so busy doing at work that a lot of times we just don't have enough free time for some strategic thinking. And as we think about AI, that becomes even more critical, right? Because you need to figure out how to strategically use AI and the questions you want to ask it. It requires some free time, if you will, on your calendar, and it's hard to do that, right?
It is super hard to do that. I'd love to hear more about some of the use cases that you've used the AI for to kind of free up your calendar, because I'm always looking for some hints.
Well, it's interesting because I just finished this morning listening to a book called The AI Leader by Jeff Woods,
Okay.
and that's Geoff.
Okay.
I had just when I exercise, I like to listen to books, and I thought it was really a pretty good book. He's associated with some company, so obviously he was talking about all the wonderful things his AI company can do. But I thought he really had some good points around that. So I've just started really over the last couple months using AI, and probably the most interesting thing that I've done with that is I uploaded images of my knee.
Oh,
And
great.
I uploaded x-rays as well as an MRI image. And I was really impressed. I use Grok. I was really, really impressed with the fact that the quality of the summary that it did, but it also linked the images together. So it knew it was looking at the
The
same
same
thing,
me. Huh.
right? And so I thought that was just really, really interesting. And I did it for a second opinion because I didn't want to traipse to another physician. I felt pretty comfortable with what the physician that I had seen told me. But I
Yeah.
said, this is always a smart thing to get a second opinion. And I thought, well, why do I need to go anywhere? Why
Right.
don't I just upload this and see what it says, right? And one of the companies that I do some consulting for uses AI to read images. So I knew
Yeah.
that AI could read images. And when AI reads images, it has a much higher rate than a radiologist reading images. So the company that I consult for example, for chest X-rays, they're like 99 point whatever accurate. And I think the average radiologist is about in the 60 some percent range.
No,
That's
you're
a
right.
pretty big difference, right?
I have actually several brother-in-laws are radiologists, and my best friend is a radiologist. So I always talk to them about it, and they're like, "Vicky, radiology is more of an art than a science. Like you go to different radiologists, they're gonna kind of look at things a little different." I'm like, I don't want to hear that. I want the same answer. This is the picture. I don't want different people to tell me different things. And you know how important it is, especially mammography for women. And I'm like, when I go to a doctor, I want to make sure that there's no questions, that they're reading this correctly, right? So it's
Right. The benefit
amazing.
of AI, for example, with imaging is that it looks at everything.
Mm,
Most radiologists will look for what they've been asked to look for.
right. So they're
So if
biased.
somebody says, hey, here's a chest x-ray, do you think that there's cancer? That's what they're looking for, but they're not necessarily coming back and saying, the person has pneumonia, the person has COPD, so on and so forth. So what I like is it really looks and then says, hey, here's everything I see, right?
Right.
That I think could be a potential issue. So I used that, and I was really pleased with that. I'll just generally do some inquiries now. If it's a topic that I really want to know something about, that I feel like I want a really good summary, I'll go into Grok. Now, obviously, I'm on Google, so the first thing you get when you put anything on Google is you get Gemini to come back, right?
Right, right.
And they're improving. They've had some missteps,
Yeah,
but even in some things that I've put in that were pretty straightforward early on, but everybody's really improving. But what I think is really important about AI is that just when you think about number one, the time suck, right?
mhm,
Where it's put a PowerPoint together, or do this, do that. It was funny. I was taking a course at Wharton, and it was a course for board directors because I like to just stay on top of things. And you had to do the summary at the end. And I spent like a couple hours, and then literally I like hit save, and I went, why didn't I just take all my notes and have AI pull this
right.
into a presentation that I could edit, right? So you still have to sort of get. I have to get used to taking that step. But number one, it reduces the time suck. But number two, it can help you think strategically. Is one of the things I got out of this book I just was telling you about. It's you can sit there and say, hey, we want to think about expansion, right? Based upon this information that I'm giving you, right? And other information that tell me if I'm thinking about this, right? What questions am I not asking? They used an example of uploading a board presentation and
Yeah.
saying, tell me if you are a board member that asks a lot of questions. What are the key questions you would be asking me about this presentation? And I thought, wow, isn't that great to really be able to anticipate the questions? Now, you do that obviously when you're preparing, right? But a lot of times you get lost in what it is that you're trying to present. And you don't necessarily think about how a board member is going to see it. So I thought that was really
It
interesting.
is interesting. I've used it for my interview process. I'm like, what questions are they going to ask me around this role for this position at this company? And it was funny because the person that interviewed me was very detail oriented and he asked very specific questions. I said, I ran the questions through AI and none of your questions came up. You really need to improve your questions. But it goes both ways. I'm like, it did really help me. I did do some of that because so much of that human component comes into. Of course, he was asking me things he knew really well, not specific to the role, maybe a generic kind of question. So there's
Right.
always that human element.
It's about building a habit, right? And
Yeah,
really starting to
absolutely.
use it. And when I finished the book this morning, I said, okay, I really need to make sure that I start telling myself, okay, before you do X, Y, and Z, let's do this. In fact, I am going to use it today because I do a deal with one of my hairstylists.
Nice.
I love to bake, and if I bring her something, I get a big chunk knocked off of my bill, right?
Oh,
And I
nice.
said, "Oh, I have an appointment tomorrow, so I really need to bake something. I haven't baked something for her in a
Yeah,
while, and I just really enjoy doing it." And I thought, okay, what I'm going to do is I'm going to put some of the key ingredients that I have in the fridge and say, okay, give me some dessert recipes that include, sour cream or
yeah.
X, Y, and Z, instead of just sifting through recipes and trying to figure out. So I'm really excited to continue to use it more. Now, the stuff I'm using it for right now is fairly light. What I can't do, and what I would caution everybody is, I can't take my board stuff. I can't take something from a company and just use it in any open AI, right? Because that's all
That's all proprietary. Yeah.
really proprietary. As we look forward on some of this stuff, we as boards have started to encourage our management teams and say,
Mhm.
listen, if we're going to start to use some of the stuff, the board needs to have access because I have looked at presentations that somebody has sent me that aren't proprietary to a company. Maybe it's just a topic, right? Or maybe it's a CMS presentation. And what I've done is I've actually run them through AI and I read the summary first. And then I go back and I read the presentation. And I love it because it helps me understand what it is I should be focusing on. It's kind of like going into the presentation, I have the gist. I
Yeah.
still go through every page, right? But now for me, it just helps reinforce what I'm reading on the page.
It's almost like a preview to the, yeah.
Exactly. Exactly. And for me, I'm the type of learner that I like to see it multiple times
Hmm.
for it to really sink in. So the fact that you can take a look at a summary and then you can go through the presentation, you go, okay, I got this, or I can connect the dots here. Because think about going through a presentation. How many times are you doing a presentation and the people you're presenting to, they're asking questions that are 2 slides down,
Yeah,
right?
all
Or
the
3 slides down. So having that summary is kind of like, okay, I know overarching where we're going and I know some of the key points they're going to make. So I didn't feel compelled then to sit and say, oh, what about this? Or what about this? Or what about this to myself, right? Because I knew some things were coming and I was just more patient with that. So hopefully,
time.
use some of that to help all these presenters that spend so much time and care in pulling the presentations together, only to have somebody, stop them and they never go off of slide two, right? How many times has that happened?
You have like an hour, and what do you do, right? Yeah.
Right, 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 right. So it'll help us board members and help us managers maybe be a little more patient, right?
Yeah. Well, patience is something we all need, right? I mean, I definitely do. How do you see, and I want to get back to the book you read about leadership. And so the board presentation example is a great example of reviewing. But what are some of the other, how are boards usually looking at AI and just evolving AI within a company and what they're doing around it? What questions do you ask?
Sure. A couple things. Number one, I ask, what are the guiding principles we're going to have around AI? As an example, as we think about healthcare, we should probably not be using AI to deny anything. We should be using AI to facilitate things, right? So, how do I facilitate authorizations going through more quickly? How do I facilitate less data needed for authorizations, right? I think that's a good use of it as opposed to, well, how do I put AI in place to say no?
Mm,
Because at the end of that no is a human who's trying to get services, right? So to me, think about what your guiding principles are. Here's how we'll use it versus how we won't use it. And, I'll never say never,
yeah,
right? Because certainly we put before AI, we put things in place and claims that we would say, no, we know this plus this is inappropriate, right? So it will stop it. So you'd code that, right? So I'm not saying that there isn't a use case for that, but really be very thoughtful. Continue to think about who the end user, who the end game is, and it's a patient, right? In healthcare. So think about your guiding principles. Number one, and then number two, what are the use cases? How are you developing the use cases? Where are you starting? No board wants to see anybody come in and say, boom, we're going to go, broad and narrow.
yeah,
Okay, let's really think about where we think we might get our biggest bang for the buck. And what I'm seeing is most of it's being used in administrative processes still.
right.
How can I speed up collections, right? How can I better anticipate bad debt? How can I move authorizations through the system faster? Or how can I get authorization or eligibility data as a provider faster? So really looking at those use cases, and again, most of them are administrative in nature right now. Where I'd really like to see us start to go faster on is clinical. And how do we make, nurses' lives easier, as an example, doctors' lives easier, as an example. And we see it coming, right? With, voice listening technology in the background, right? And then the script is done and there you are. But when I think about this, and we think about the case managers, right, and the care managers that health plans have.
Yeah,
You've heard me say this before. What the ideal situation is today, you may have a care manager that has, 500 patients that he or she manages, right?
right.
If you're using AI appropriately, that care manager could have 3,000 or 5,000 or 10,000, because what you want is you want all the relevant information coming in about a Beth Bierbower, as an example, lab data, doctor's visits, prescription data on a real time basis. And then you sit there and go, wait a minute, use AI, say, I just got a lab result here. Bierbower ought to be kicked up in the queue. That's who I need to call now, because that's who's most at risk of a hospitalization, right? Or an adverse
Yeah,
event. as opposed to it's Tuesday. Here's who I'm going to call on Tuesday, and here's who I'm going to call on Wednesday, right? And we just need to get better at that, right? We have this
Predictive,
data,
more of like predictive analytics, right? Instead of just
yeah, and real time, right?
real
Because we know
time.
that predictive analytics has been out there for a long time, but we need to really think about a retailer. We need to bring it to point of sale,
Hmm.
right? So we really need to bring it to life on a real time basis so that when those lab results hit and it's Quest or LabCorp or whatever, how do we grab that information? How does that information come into us real time? Then we go, wait a minute, we have an adverse event here,
Mm.
right? This person's lab data is way off. How does that care manager then pick up the phone and call that person? Or how does that person get a text message and say, you need to call your care manager right away? This is really important. And today we're still relying on humans, number one. Number two, a lot of the data just isn't being used. It comes into the data warehouse, but it's just not being used. It may be being used, to your point, in predictive analytics for the long term, but it's not being used in that use case that I talked about. So that's where I say, how can we help the clinicians more? You know, the case managers and nurses that, come in the home, the nurses that are, at the hospital, because all that stuff is going into medical records. They have to look for it,
Yeah.
right? And determine what's what.
It's almost, and that's actually the problem you identified is exactly the problem that my husband deals with every day, right? As a physician, he's like, I wish when I came into the room, I already had the highlights of what this patient, what do I need to ask them? Like you were saying, a preview of a board presentation, except a preview of the patient saying, okay, think about these things. Look, something's off here. You might want to have more of a discussion around these points, but already that suggestion, and that would help facilitate a lot of those discussions so the doctor can spend more time with the patient really understanding where they're coming from versus trying to collect the notes and trying to do the duplicate work that maybe already exists from a different record that came in earlier.
Right. And how the doctor then can spend his or her time asking those different questions, right? Challenging what they're seeing and saying,
Yeah.
okay, all this was ruled out. Let me look at these things and how do we roll it out? I just know that I have a relative. My sister has been. Both my sisters have unfortunately been in the hospital
Oh,
over the last 6 months, but one of them has been in 8 times in 5 months. I'm shocked at the amount of guesswork that is
yeah.
going on with her life. They don't know what the issue is.
Right.
And one doctor admits her and never comes in to see her. If she goes to one hospital, the other hospital doesn't have the records. And there's just a lot of guesswork going on.
Yeah.
And you just sit there and go, in this day and age, how can there be so much guesswork going on? Right?
Yeah.
And it's just very, very,
It's very
very, very.
disappointing and very frustrating. Actually, I read a book about this, and I want to give Malcolm Gladwell the credit for it. But essentially, what they found is in his book, based on the research, is people living in small towns that had like a physician following them throughout their life actually had better outcomes than people living in bigger cities where they might see multiple doctors throughout their time there because there was no sense of ownership from those doctors around that patient. And so I think a lot of what you're probably seeing with your sister is there's no sense of ownership. Yes, that it's a patient, but it's not their patient. It's not someone that they know the family of or the children of or they've seen grow up. So they actually said if you want better outcomes, you want to have that relationship because then there is this human stake in it, which I thought was really interesting,
Yeah.
part of that research study. So maybe with AI, we can maybe actually spend our time with the patient, knowing who they are, understanding their background, and following them versus trying to collect all these records and just running tests without really having a purpose.
And also collecting the patient's input.
Yeah,
One of the issues that my sister had, she said, I can't tolerate this medicine that they wanted to send her home on.
yeah,
And so they said, well, we don't really have any other choice. I said, well, you do. Here's your other choice. And they said, no, we don't do that. And I said, well, you should, because I'm on the board of a company that does this exclusively across the nation. So this isn't something that's odd. What was interesting is my sister was absolutely right. As soon as she took that medication and was home, She was sick and back in the hospital in 2 days. Totally right.
Hmm.
And we were told by a nurse that, oh no, this medication and this medication are exactly the same, and they weren't exactly the same. And so the one she said she couldn't take because it had an extra ingredient, the ingredient was what made her sick. So to me, it's sort of like, how could that nurse have used that to really talk to the doctor? Because the nurse was just like, well, here's what the doctor said, right? So I think that sometimes patients do know best, right? And so how can we solicit that input?
Yeah. I actually spoke to a startup, and they collected all these records from Boston area hospitals about reflections on medications. And what they found when they collected the data, because a lot of times, women don't participate in the drug studies before they're released, and things like that happen in general. So this is actual data from hospital records. And what they found is like we were playing around with data, and one of the medications only caused an issue for women over 50, and it actually caused blindness or hearing, like something like that. But it was only for women, it was only over a certain age. And like things like that are not known a lot of times by the doctor prescribing the medication, because a male the same age might not have similar symptoms. And so they're like, hey, I've read the studies, it seems pretty safe, where are you coming with this? But it's these types of AI models and this data that will allow us to kind of, hey, well, maybe you should be prescribing this because she kind of fits this demographic. And it does seem to come up with this side effect very often.
What's really interesting is AI should really be able to help us tailor plans to the patient more, right? I
Yeah.
think of I use the Noom app, right? Because I'm always on, not Noom, Lose It app.
Okay.
I did use Noom. I've used every app, right? But I use one thing I like about the Lose It app is if I don't track and I haven't put my breakfast in here yet, it prompts me right away. I also get an alert when I enter something that says, "Hey, when you've eaten this food in the past, you've stayed on track for the day." And
Interesting.
I just thought that's pretty simple. Like if I put
Yeah.
down strawberries, like okay,
Yeah.
when you eat strawberries, you usually stay on track for the whole day. Or when you eat reduced calorie bread, you're really on track for the day. And so I thought that was really, really interesting. It's motivating, but it's looking at my patterns. So if you think about it and think about, somebody in therapy, right? And you sit there and say, okay, if you record and gather the information from what they're saying from those visits, how many times are you hearing X, Y, and Z, right?
Mhm.
That then might be associated with an ER visit,
Yeah.
right? So how do you use AI to really filter through that information and be able to give that feedback to the doctor, to the patient directly? I
Right.
think it's just really, really critical. And we think about medication here, Ms. Vicky, right? How hard that is. How do we use AI around that? How do we use AI to help make sure when somebody's dispensing something in the home or in the pharmacy or whatever, that there isn't a prompt or something that can say, wait a minute, the last 10 times, you've done this 1,000 times and you didn't do this time,
Yeah.
right? So it doesn't have to just be, in my mind, when I think of data, it can be observational, right? Hey, you missed putting X, I didn't see you put X, Y, and Z in. So
Right.
I think there's a lot of different types of media when we think about AI. We can observe workers, right? We can use text to do it. We can use data, lab results, and things like that. So I think it's just immense, which is why you have to go back to what are your guiding principles? How do you take it, slow but fast,
Yeah.
right? And that's just by being very, very focused and say, okay, listen, before I use this on anything that's patient related, let me use it on administrative tasks, right? Or administrative information or marketing or something like that, that helps you build that muscle, that then you can start to move into areas that are, more risky, if you will. And then I would just say you have to own it too, right? You can't just, what we don't want to have is people saying, well, this is what AI did.
Right.
It's not my
ChatGPT
fault.
told me to do it.
Right? Yeah. Grok told me to do it, right? Uh, so you're going to have to figure out how to help people, take accountability. Because If you're an actuary, you've developed a model and somebody put in a wrong number
Yeah.
or they had an error in the formula, okay, well, there's a person accountable. Now, most people are partnering with AI partners, right? But you have to have somebody that really says, okay, I need to think about what the inputs were. What questions did I ask the model, right? Were these the right questions or were they reasonable questions? Were they sound questions, right? So you just have to make sure that people understand that they still have some accountability, right? Because right now what we think of is, hey, I got homework and I'm in 10th grade and I'm just gonna run it through AI.
Right. Well, it's the critical thinking, right? And the deep expertise becomes so important because AI can tell you all kinds of things, but if you're not sure what that information should look like, you're going to get into a lot of trouble.
That's right. Right.
Yeah, it's about really still using your brain. I've been using AI a lot for requests for information proposals, just as part of my job. And we have like an ask feature that helps generate the response. But you still have to, like, sometimes it gives you a confidence score like 98 out of 100. I'm like, oh, that doesn't quite sound right. Like, I don't think it quite got what I wanted it to say. So it's interesting. It's not just copy and paste, right? It's
Right.
really thinking through it. And
I know somebody else that used it to respond to an RFI.
yeah,
They were required to respond, right? And so they said they uploaded the presentation and they used Chat GPT and
yeah,
said, here's the question, here's the data I have, and uploaded some slides that they had done
right.
and formulated a great response. They reviewed it, made some minor tweaks, and said, what would have taken me probably an hour or two took me 15 minutes. So I think it can be such a time saver
Yeah,
for things and even more sophisticated things once we have the confidence level to your.
absolutely. And I'm just wondering how that whole game is going to change, right? Is part of this. Will we still have RFIs? Like, with the amount of information that's out there, does it make more sense to really like dive into a different review process where you meet the people, where you check more references, where you do more qualitative analysis because the quantitative can be gathered in other ways? So I'm like,
Yeah, note to the consultants out there, right?
right.
on the RFIs and the RFPs, right?
Yeah, exactly. Exactly. No, it's super interesting. Talked a little bit about your class at Wharton. I'm actually planning to take a class at Cornell on security and AI strategy because just based on the field I'm working in, I'm just seeing AI just not only, the good that we just talked about, but there's also the bad that's associated with it. It's becoming very easy to extort information from companies like a coupon code or potentially cause an attack where they change your password through a prompt in Microsoft Outlook. So there's just like things like that to be aware of. And of course, deep fakes, right? The fact that someone can completely impersonate you or your child and or your parent, whoever.
Wow. I hope if somebody does me an AI, they make me look better and thinner.
I know, right? You don't even have to use the Lucid
Incredible,
app
isn't it?
anymore. You can just, yeah. I'm like that's my plan. I'm actually gonna download that app and see if I can use it. But yeah, I mean, it's just you have to think about the good and the bad. So like as we optimize these things, what is the exposure level for your organization? What are the security attacks that can be generated? What is the brand related aspect to the security attack that could damage your brand significantly through chat interface that you're providing, things like
Yeah, the CISOs, the cybersecurity people, they just have more on their plate now, right?
yeah.
And the other thing is you want to make sure that your data is not leaving your company, right?
Mhm.
So when you think about a partner that you work with, well, what happens to your data? Is it locked into the model that you're using? And while
Right.
that model can be upgraded, that data can't be extracted. I think that's really, really important because your data is proprietary and you work really hard for it. And you don't necessarily want that going out there into the realm of the unknown and allowing competitors to have access to that. So I think that that's really critical. Into your point, the hackers they're gonna just find something new to hack and bigger to hack and a way to make even more money. So it's going to be really, really critical. Which again goes back to from management's perspective, from the board's perspective, that these topics, cybersecurity, AI, they come to the board meeting I mean, that's how critical that this is. And, it's not just sitting there, oh, it's just in a committee. No, the whole board wants to hear about these things and have a really deep understanding of what's going on and how comfortable we feel. And those are the questions they ask. Where's our data going? Is our data going outside the company? Well, who has access to this? How many people have access to it? Who are we using?
Yeah.
Right? Are they reputable? Watching what happens at other companies, right? So I think you just have to really be careful. The one thing I think about a lot, and I'd like others to think about, is sometimes when we think about AI, we
Hmm.
think about, because just this morning when I was working out, as I was heading to my elliptical gym, I saw on the TV there, the war for AI talent.
Yeah.
And it's kind of like, okay, let's think about this, because yes, we need people who understand large language models and all that stuff and develop that stuff. But anybody can go out and leverage and use AI. And I don't care if you don't have a high school education. I don't care if you don't have a college education. I don't care if you're a barista. It doesn't matter. This is something, I think, rather than looking at it as this is going to widen the gap between
Right.
the haves and the have-nots, I sit there and say, think about all the people in the technical trades or the service trades, and if they can start to become proficient on this, and it's free, it's out there, right? There are lots of ones that you can use for free. Think about how they can start to create maybe financial security, right? They can create opportunities to do their own gigs on the side, right? Their own side hustles. Or they can create opportunities to perform better at work, right? Based upon what they're using. So I would really encourage folks of every background, every educational level to really go out and start to explore this, even if you do it for fun things like, okay, I'm going to do some landscaping in the backyard, or change my living room, right? I mean,
Or bake a cake for your hairdresser.
yep, yep. So hopefully she doesn't see this before I get there tomorrow.
Yeah.
So yeah, I mean, there are just so many opportunities out there that it does not have to be a have and have not. That person may not be the person developing the large, language models, right? However, when you become proficient in something, your user feedback is absolutely critical to the people behind the scenes that are developing things. So I just want people to think about that, because oftentimes people sit there and go, well, it's going to cost me my customer service job, right? It's going to cost me my job in billing and enrollment, or accounts payables, whatever. No, go out there and start to learn this stuff, because you can be a leader in determining how to bring it to your part of the organization. But I know once this gets going, the side hustles are gonna pop up for people that are with this, right? It's
Yeah.
just gonna be absolutely amazing, right? It's
It's
gonna be
gonna
bigger
be.
than podcast, Vicky.
I agree. I'm still looking for that idea. So Beth, if you have one, I'm in.
Yeah, I'm still noodling it
Yeah,
too.
let's do it. Let's start a side hustle
But I
together.
really think it can really, it doesn't have to create a split. I
Hmm.
think it can really help with additional, parity, if you will, and giving people opportunity, because the big thing is I can't remember his name, who wrote a book, and he wrote a book basically about technology. And my takeaway was that he was basically saying, these people in rural America, they don't want to use technology, they don't want to learn, they don't want to do this, they don't want to do that. Well, no, well, maybe some of these people who are making $30,000 and $40,000 a year can't afford $1,400 for a new iPhone.
Yeah.
Maybe that's the issue. When I think about AI and I think about it being free, and I really do, those companies that have given away for free, I think it's just wonderful. Now you can figure out, how do you take this? How do I take it and use it in my daily life to make my daily life easier, right? To save money. How do I, to earn more money, to do whatever. So I think there's a real opportunity here that I think people should say, wait a minute, instead of being afraid that I'm going to lose my job over this, because I think about this, right? Since I'm a retired executive, semi-retired, right? I sit there and say, I'm not in the thick of things anymore. So how am I going to make sure that I don't become a Luddite and, don't know how to use this? I think there's just some real opportunity here, and we should really be encouraging people, even if we sit there and say, listen, we're not going to have this available to everybody at work, but when we were at Humana, how we did some crazy things in my segment, right? We taught people about budgeting. We did extreme couponing seminar. We did a seminar for this is if you have a kid that's going to be thinking about going to college, here's the process. We brought people, and we like to do crazy things. To me, it's kind of like, okay, what are you doing as an organization to say to your folks, listen, we're not deploying here, but we want to teach you about this stuff.
Mm,
Here's what's free on the web. Here's all that you have to do, because all you have to do is type in some questions, right?
right.
It's not that difficult, or ask it some questions. I'd like to see more companies, because we always talk about what are you doing to upskill your people, and people automatically think, oh, that means I have to go to coding school or something like that. That's what's great about AI. Don't. You
Right.
don't. You just have to know how to think. You have to know, hey, these are the types of questions I want to ask, right?
Just get curious. That's all it is.
Yeah,
Yeah.
and it presents such a great opportunity that I worry that sometimes people are missing that, right? So think about it. If you're there and you're in a company, how do you, and maybe your department isn't using it, and you're a department head. How do you do a 2 or 3 hour seminar? One of the companies I'm on the board of, they did that they did a half day seminar. Everybody could listen in via Zoom or Teams or whatever, and they talked about it and what was out there, and it was very well received, right? Because when people are afraid because they don't know something, then they fill in the void, right? And it's always negative. Well,
Yeah.
if you can start to educate people, and then they sit there and go, like me, like, okay, let me just try it with this, right?
Exactly.
And so that's what I'd like to see, and that's something I'd encourage your listeners to really think about. How can you help educate people in this? How can you educate yourself on that? But how do you make sure that people have an opportunity? Because sometimes what they just need is a little assistance in getting started, right? Because they
Absolutely.
don't know. There are a lot of people out there that maybe have heard the term but really don't know what it means, and there's probably a lot of people that haven't even heard the term yet.
I love that. Thank you for the encouragement. That's exactly why we have this podcast, why you're on it, because it makes all the difference, because we do need everyone to be using AI in some way, because it doesn't take technical skills. It just takes a little curiosity and a lot of exploration.
Thank you. Thanks for having me.
Thank you so much, Beth. It's been a pleasure. I'm so happy that we got to catch up, and I look forward to hearing more about what you're doing on your boards and how you're being, how you're involved more with AI as part of
All
that.
right. Thanks, Vicki. Take
Thank you
care.
so much. Take care.
Bye bye.